welcome to Talk Trillium, Partnering for Patients. My name is Patti Cochrane. I'm the Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which has Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre as part of it. I'll be your host on Talk Trillium as we talk about the work we are doing to create a new kind of healthcare for a healthier community. And today's topic is really about research, innovation, and education. And it's my great pleasure today to welcome Dr. Dante Morra. He's the Chief of Staff for Trillium Health Partners.
Thanks,
So
Patti.
welcome.
It's wonderful to be here.
Great. So my first question, you were at the University Health Network and you were leading a center on the Research Institute for Complex Care. So you were very involved in downtown Toronto and leading that work. What attracted you to come out this way to Mississauga?
Well, I think the first thing, Patti, is Mississauga and the West is this incredibly diverse and vibrant environment. And there's, it's an area that I grew up in. I was born at the Mississauga site, and in many ways I sort of feel it coming home. And I don't know, most people don't know actually the complete size of the Trillium Health Partner platform. We have 3 sites. We have 270,000 emerge visits, which is the equivalent of the 4 hospitals of UHN, Princess Margaret, Toronto General, Toronto Western, TRI, Mount Sinai, and about half of St. Mike's. So there's there's this huge organization out here in this diverse community. And a lot of my work was in changing the operations and the flow and how hospitals and regions work and innovating around that. And so the opportunity to be a part of the great leadership team at Trillium Health Partners, to work in the diverse environment of Mississauga, to work in the West, and to actually use that footprint and that structure to lead healthcare was something that I was just so excited about.
So it was really the critical mass of activity, clinical activity that was happening here at Trillium Health Partners that attracted you. So what would be the role of research and innovation in that activity?
So I think when people think about research and innovation, they often will think about us trying to find a cell or a molecule or doing almost like basic science research. But actually what is some of the most important research right now is actually how do we design healthcare? How do we deliver it in new ways? How do we use technology? And often people will share their stories of, if only it worked this way, if only it was more patient focused, why can't they phone me rather than me actually coming to visit? And that type of research is called health services research or implementation science. It's about actually looking at a large system and changing it, but then not just changing it and saying it works, but actually doing the evaluations around it. And what we know is when you're looking at outcomes like people's survival, their experience, cost, that some of the most important work that's done within healthcare is actually health services research. And the environment within Trillium and their history of innovation, the agility, the ability to change, and also this large footprint in a community that's served in one group has the opportunity to lead internationally in this type of research, and that's one of the things that really attracted me to this role.
Yes, and as large community hospitals, I think we are able to be a little bit more agile than those that are in the downtown core. So the next question has to do with the Institute for Better Health. It was launched in January 2014. Tell me about your role in the Institute.
Well, one of the things that as I came out to Trillium, I was lucky to bring a couple of the members and thinkers from the University Health Network and the Toronto General Hospital who are experts in design and technology and methodology and research. And the key concept behind the Institute for Better Health is that we will use the population. We will do work to actually improve care across 1 million people, not just for a small group of people, but across a whole population. And we'll use the hospital, our partners, public health, our school system, working with the police force, a whole strategy to actually how do we design a healthcare system that gets the best possible outcomes. And I think one of the very important pieces that's almost like a nail into the ground that's very different is the concept of the Institute for Better Health. We are focused on actually improving health within a population. We're focused on the experience of health, on how long people live, and but not by trying to deal with disease, but actually by driving health. And when we talk to patients, their family members, that's actually their goal. their goal isn't more treatment. It's not more episodes in the emerge. It's not more tests. It's actually how can I be more healthy? How can I have a better life? How can I have a longer life? How can my community and my family unit and my environment be healthier? And I believe the Institute for Better Health will emerge as an internationally and world-leading organization that is moving towards population-level health and systems to deliver that health.
And can you give us a little bit of an example, perhaps, of some of the work the Institute is focusing on or looking at now?
So to give an example of some work that we're working on is, you might take a condition, and I'll get a little bit technical here, like atrial fibrillation. So atrial fibrillation is a heart condition. And so the heart condition puts you at risk of having a stroke. And so often what we do is we think about how are we going to take care of that stroke? And how are we going to take care of that heart condition? But what we know is if we actually take care of people earlier on, so if we prevent a stroke, if we take care of that condition so people don't come to the emerge, if we actually do some of the preventative work. And so what you start to think about is not just seeing a population or people showing up to your door and dealing with that. That's important, and we have one of the best regional stroke programs, one of the best cardiology programs, which I know, and you've been someone who's helped build that. But it's actually thinking about the whole patient along the continuum. How do we screen for it? How do we prevent it? And constantly moving upstream so that we prevent strokes. That's actually better for the individual. It's better for the system. You get better outcomes. And so that's just one example of a disease state where there's been a series of work that's been done, that's been published and has been internationally known, and there's been a whole series of work as we move upstream on that value proposition.
Excellent work, hence the name Institute for Better Health.
Absolutely, and it's constantly about driving to what people and populations want, which is more health, not more treatment.
Anything in the future that you want to comment on? Any initiatives that we might be looking at?
Well, I think what we're looking at now is how do we align and work alongside many of our other key providers. So whether that's working with the police services and the school systems around mental health. There's a big program, the Medical Psychiatry Alliance, which is a great partnership with CAMH and the U of T and Sick Kids. That actually was led from Trillium Health Partners in collaboration with those groups. We're looking at palliative care and how do we actually provide dignity to our population and serve that population around their last year of their life and actually have that conversation. Looking at a whole bunch of other population level interventions, even how do we actually take care of obesity and diabetes and looking at the nutrition of school-age children and dealing and preventing diabetes. And I understand you might be having a guest to talk about that later. And so I think what you can see is there's a lot of work in the hospital about patient experience and aligning care. But I think our big difference will be thinking about how we provide a system of care and work on that at a population level. And so we'll be very excited to come and talk more about those individual projects and some of the work that we're doing.
So it sounds great. It sounds like we're doing a lot of innovation around partnerships and really changing the way we view our problems.
Absolutely.
So now I'm going to switch topics to
Yep.
education because I think you're involved in almost everything we do at Trillium.
Yep.
We became a teaching hospital in 2011.
Yeah.
So talk to us a little bit about the unique role of this Mississauga campus.
Well, I think it's such an exciting time for the West and for Trillium Health Partners and for healthcare. And we have a long history of training nurses and medical students and social workers and a whole gamut of health professionals, and a real proud history of training people as teams in an interprofessional way. Becoming a teaching hospital is formally about having an affiliation agreement or an agreement with the university. And we entered into that agreement to train 216 medical students that'll get their entire education out here in the West. And what's been really exciting to watch is the build within the West, within our organization as we train those students. And we'll be graduating our first class of 54 medical students because they have 4 years of training coming up this June. And it's a real monumental moment for our community as we've been training so many health professionals. We've been doing it in a different way. They're integrated into our community, and our first class will be graduating. And so I'm incredibly proud of all the work that's gone on from across all of our teachers and our educators and the organization, and also with the University of Toronto, Mississauga, where there's been some great work done. So I think it's a really exciting time for education and healthcare in the West.
And what are the students' experiences like out here?
Yeah, I was actually having a dinner with a variety of the medical students. And I was sitting there, and there was our Mississauga students and some students from Toronto, and we were talking about like how many deliveries they would have and their volumes. And one of I was saying, so how many babies would you deliver on your rotation? And one of the students who was trained in Toronto at Mount Sinai, and these are great organizations which I've come from, said I delivered seven babies, and the Trillium student or the MAM student said, in a night, right? And so that and he said no, in a rotation. So what we're seeing is our students are getting really high volumes of care, direct supervision by staff members. They're getting more of a community feel. They feel more attached to the organization. They see it in an interprofessional light. They're thinking in systems. And that's not a takeaway from the great education that's been happening elsewhere. But I do think that they're getting a unique experience, and I think it's helping them become more connected to our community, more connected to our patients, more connected to our organization, and I think better future physicians.
And so we actually are influencing the delivery of care out into the future through this medical education. Now we've got 30 seconds left, Dante. You are also the Chief of Staff for Trillium Health Partners, and I must say how proud we are that you came to our organization. You're clearly got a vision around research and innovation and education for us. Just in a nutshell, what's it been like joining Trillium Health Partners? Are you happy with the move?
100%. I couldn't imagine anything different, and it is a vibrant, exciting organization. I'm so proud to be part of this organization. I'm so proud to be from the West and serving in the West, and I think we have a great chance to lead healthcare internationally.
Thank you so much for joining us today, Dante.
Thank you, Patti. It's a pleasure.
Hello, and welcome back to Talk Trillium. I'm really pleased to introduce my guest today. It's Dr. Pamela Coates. This segment will focus on medical education, and Pamela is the Medical Academy Director for the Mississauga Academy of Medicine at the University of Toronto. So welcome, and I understand, Dr. Coates, you're also a pediatrician in your day job.
That's true. That's certainly always been my contribution to the Mississauga community. I've been a pediatrician here for a very number of years now.
Great. So back in 2011, we opened the Mississauga Academy of Medicine at U of T. So this must be an important year if I count 4 years forward. What is happening in 2015 for our learners?
So this is the finish line for us, Patti. We really get to charge through the ribbon this year. We will have completed all 4 years for our first cohort of students, and we have full enrollment this year. There are 54 students each year at the Mississauga Academy of Medicine. So we have now full enrollment, and we have our first class poised to graduate. So it's definitely a very exciting year for us.
So these are 54 medical education learners, and what it means now is they can go complete an exam to become a doctor, a physician. Just for our viewers at home, just to make sure you understand about medical education. So we've been teaching students, and now they're going to become full-fledged physicians. Is that what happens next?
That's right. They'll be completing their licensing exams coming up very soon. We really expect them all to be successful, and then they'll be licensed physicians in the province of Ontario should they choose to stay here or wherever they go. Most of our students will be going on to postgraduate programs in Canada, and they'll become licensed medical trainees. So now they'll go on to fully develop themselves as specialists. They could become specialists in family medicine or surgery, all the different disciplines that medical practice offers.
That's excellent. 2015 is the first year of our graduates. So back in 2011, what was the impetus for University of Toronto to think about expanding its doors to Mississauga for medical education?
So we did at that time experience a growth in medical learner positions in Ontario, and so that was an initiative of the Government of Ontario and partnership with the Ministry of Health and the Ministry of Training, Colleges and Universities, and it was deemed that it was necessary to have more graduates from medical schools, MD degree graduates, who would be able to practice in Ontario and in Canada. And so the number of positions was increased at that time, and we saw also an increased number of learners at the University of Toronto. And the University of Toronto was looking to do something different and innovative, and they looked at Mississauga, and they saw the wonderful facilities, health care facilities that we have here in Mississauga, and the population and community that we have. And I think that everyone felt that our community could support a really top-notch medical learning program. And as Mississauga is the 6th largest city in Canada, many medical schools are housed in smaller communities.
So Dante spoke earlier in the earlier segment about just how busy Trillium Health Partners is in relation to many other hospitals. So there's large volumes of clinical activity. I would imagine the medical learners benefit from that experience. Is there a difference in what the medical learners experience in Mississauga versus other places?
Absolutely, Patti. We have the greatest learning environment a medical student could really hope to be trained in. I think that one of the things that we offer the students is an opportunity to really interact with our community and our patients frequently, to learn from the patients about their patient experience and their journey, to learn from other health professionals in the team, and to learn from the physician teachers that we have at our hospital. And that together really puts forward a fantastic package that our learners are really appreciating. I think one of the key advantages that we have is that our environment isn't overwhelmed with medical learners. I don't think our community has experienced a very significant impact that they're feeling overwhelmed with learners. They enjoy meeting our learners. They enjoy the individualized attention that our learners can provide. And we certainly enjoy the challenging questions that our learners pose to us on a day-to-day basis. And it's definitely been the experience in many academic centers that having learners in the environment makes everyone just a little bit better at what they do.
Keeps us on our toes, I would imagine.
It sure does. It's nothing like a few challenging questions to make sure that you're on your game.
That's good. So when do the learners start interacting with the hospital? And do they participate as part of the care team?
Certainly they do, because just like I told you earlier, Patti, the day that they graduate, they become licensed physicians in Ontario. So throughout those 4 years, we have to prepare them. So that's their journey. And so right off in their first week, we have them starting to come to Trillium Health Partners to be part of the environment. Of course, at the very beginning, they're not taking on any clinical responsibility, but we do have a great participation from our community in our volunteer patients program. And I'll just put in a little plug that if community members would like to participate and they go on our website to our volunteer department, they can participate in our volunteer patients program. And the patients help our learners learn how to interview and examine patients, and then they progress into the real life clinical environments as they mature through their training process. A lot of very controlled learning experiences happen in the first 2 years, and then in their third year they're truly part of the healthcare team. Great. And that's very fundamentally important for them to really participate.
So we have a video that'll show us exactly how that works. So let's take a look at how these medical learners interact with our clinical teams.
Risk risk of dying from prostate cancer.
Medical school can be daunting. It's a lot of material, it's a lot of time, and they ask a lot of you.
I want to test something called Trillium.
But I think there are people along the way who are not holding your hand, but showing you a direction and pushing you to go down that direction.
It's that initial deflection down.
And they're instrumental to our learning. They're instrumental to the knowledge they share, not just as the theory of medicine, but also the art of medicine. And for this, I don't think we can pay enough thanks and appreciation towards them.
So not only is it important to get information about the history.
I know we all remember those people who have had a real impact on us in our learning and growth. And I can still remember the instances and the people, both physicians and nurses and other educators who have set me forth on my career and made an impact both in how I see the discipline of medicine but also approach people. And what I'm so incredibly proud about right now is as I speak to medical students and I see what's happening at Trillium Health Partners, we have this incredible group of professionals who are training the next generations of medical students. And I know that they're going to look back at their experience at Trillium Health Partners and with those outstanding individuals and be so grateful for their generosity and the impact they've made.
Abdominal exam was done to show some fatty liver.
It's kind of cool to be in that, it's almost like a tradition of learning. Often it'll come up, the staff will say, or the resident will say, when I was a medical student, this is why I thought this, and this is how I learned to do this better, or tricks of ways to calculate things or to remember things to look for. It's really nice when they can identify where we're at and then teach at that level and help push us to making progress, going to the next level.
Okay, great.
At Trillium Health Partners, we are creating a different kind of healthcare, and the medical learners have become a huge part in that. They participate daily in our interprofessional rounds.
30 to 60 minutes after the infusion started.
And they work with their learners who have done an amazing job at allowing them to understand the importance of creating comprehensive care plans to our patients that we service in our community.
And then ask them to start using the intermittent catheter.
It's been an honor to watch the medical learners develop into amazing practitioners, and it's also been an honor to watch their learners embrace their role in helping these practitioners.
For medical students, we learn a lot of stuff in the classroom, but when we get into clerkship, sort of are lost because we're into the realm of clinical care we've really never been exposed to before.
We are going up point 1.
The help that we get in sort of navigating and finding our way around comes from all the allied health professionals, from the nurses to the pharmacists and everybody in between. I think they're critical in helping us understand how team healthcare is delivered and understanding what each person's role is in the team and how we can sort of fit into the team as well.
It allows you to really just go systematic.
Teaching in any field is a great responsibility. Our doctors take teaching medical students very, very seriously.
Intercostal indrawing, so between the ribs gets sucked in.
Teaching does not come naturally to all of us. It's a skill which is learned. We have doctors and staff who learn the skill extremely well. They are teaching the next generation of students to become good doctors and then good teachers. We're proud of what we've done at the University of Toronto Mississauga Academy of Medicine and at Trillium Health Partners.
We are so proud of what we have done and teaching the future doctors in this community. What are you most proud of as you look backwards on the first cohort graduating this year?
Patti, I think the thing that I'm most proud of is each individual student that we'll see graduate. I can't tell you how personally proud I am of each individual student. I think we're all proud. We've all worked very, very hard, but this is their moment. And you and I have shared how proud we are of our own families and how proud our parents are of us. And we know that this is going to be one of the most important moments in their lives as they embark on their careers. And I know that they will truly seize the opportunity to serve. And that's what gives me great pride.
Now, if I were a patient in our hospital today, how would I know that I was being treated by a medical learner versus a doctor or my doctor?
Right. So I think that patients can all be confident that our students will identify themselves to them. And we know that healthcare can be sometimes stressful, and sometimes patients aren't really sure when we introduce ourselves. But students are very careful to tell patients their name who they are. So they will introduce themselves as a first or second year medical student. The more senior medical students may just introduce themselves as a senior medical student. The teaching faculty will introduce themselves as their teachers and their supervisors, and so that all that should be very clearly identified. And also, I think that I can't remind everybody enough that it's really okay to ask, who are you and what is your role in my care? And so I just would encourage if anyone feels uncertain at any time. And also our physicians really closely supervise the trainees at all times.
So congratulations to you and to Trillium Health Partners and to the Mississauga Academy of Medicine for the first year graduation this year in 2015. And thanks for joining the show today.
Thanks very much, Patti.
Yes, thank you. Welcome back to Talk Trillium, Partnering for Patients. This segment is about the Institute for Better Health. And joining me today is Dr. Ian Zenlea. He's a pediatric endocrinologist recently coming to us, to Trillium Health Partners. Welcome, Ian.
Thank you.
And Dr. Marilyn Knox. Marilyn is the president of the Institute for Better Health. Thanks for joining us. So Marilyn, the first question for you. You are the president of the Institute for Better Health. The Institute opened in January 2014. What will it do for Trillium Health Partners?
Well, Trillium Health Partners is a wonderful, large community hospital, loved in this community, and it's expanded to be a teaching community hospital, and now we're well on our way to becoming a researching teaching hospital. In a place like Mississauga, it's the perfect place to do it. It's a contained community. People live and work here, love their hospital, and this is a place where we're not with test tubes doing discovery research, but rather looking at improved models of care and really following patients in and out of the hospital and how we can make it better health care and better health in this community.
Great. So our strategy at Trillium Health Partners is to create a new kind of healthcare for a healthier community. So how does the Institute actually contribute to that strategy?
So we like to think that we're here to have a new kind of research impacting a healthier community. And so we're doing some things inside the hospital, for example, helping with improved flu campaigns, hand hygiene, and now we're thinking even more beyond what we do around patients with cataracts and how they are brought into the system and processed and prioritized, wound care, children, and you'll hear more about that from Ian. So there's a broad cross-section of things we're doing, and they will all add up to better transitions, probably better beginnings in life, and eventually we'll get to better endings as well.
So really about better health.
That's it.
So Ian, you are a pediatric endocrinologist, but I understand you recently joined the team in the Institute. So tell me a little bit more about your role there.
Yes, I did recently join the team in the Institute. I'm actually honored to be here. I just came from the United States, where I was in Boston for 4 years. So I'm new to the province, new to Canada, and it's been a wonderful reception. So I am actually appointed.
Even the winter?
Even the winter. In Boston, it was actually much worse this season, so this is fantastic compared to there.
Tropical.
Tropical. So I'm actually appointed as a scientist in applied research. So my responsibilities are really numerous. Some of them are to just do these wonderful things that Marilyn has been talking about. I'm going to be using novel and innovative research tools, including design, engagement, and evaluation, to launch these research projects that really investigate ways to communicate health problems and health solutions.
And what's your day job? Can you talk to us a little bit about what you do during the day?
So that's a really great question. So I spend some of my time in the Institute helping them with some of their strategic initiatives. And then I'm also a clinical endocrinologist. So I see some patients on Friday mornings in General Endocrine Clinic at Credit Valley Hospital. And I also do some work in the diabetes programs at both Mississauga Hospital and Credit Valley.
And all for kids.
And all for kids, yes. Only children.
That's wonderful, because we've got a wonderful regional women's and children's program.
Right.
Great. So thanks for joining us there.
Oh, thank you so much for having me.
Now, is there something specific that you've been working on?
So I've been working on, besides some of the research strategy that the Institute's developing, we actually have this really new exciting program that we're developing called the KidFit program. And it's actually a pediatric weight management program, which is new for the province of Ontario. It's a weight management program, so it's really open to, it will be open, it's actually up and coming, to children between the ages of 2 and 17 years old who are overweight or obese. And it's going to be a treatment program, meaning that you have to meet certain specific criteria to become enrolled, and it's going to teach families and empower families to make healthy lifestyle choices. And the staff, being multidisciplinary, will include myself as the physician, a dietitian, a clinical psychologist, and a social worker, because we understand that mental health and mental health care are such important components of pediatric obesity treatment that we really feel strongly that these roles need to be included. We also have an exercise specialist too that we're hiring.
So research into teams, like I think it's a different kind of research that you're talking about, Marilyn, but it seems like these interprofessional, interdisciplinary teams are so valuable now. And is there any kind of research in the value of a team versus individual practitioners? Is that changing the paradigm of the way we treat patients in the future?
Well, if we think about a project you're involved in medical psychiatric care, patients come in and they're a total package themselves. So if you have a physical health issue and a mental health issue, you want someone or a team of people that are thinking of all of you rather than this issue to that issue. So that's a really important part of, I think, one of the fundamental tenets of the Trillium Health Partners strategic plan, and that is patient-centered care. So you think about patient-centered care, we always think about quality of the patient experience, and now we're thinking about research, innovation, education, that all comes together, and the patient is at the center of this.
Now, you mentioned so many other initiatives that the Institute is involved in, and they all sound amazing. Can we talk a little bit about the cataract work that you're doing?
Sure.
We have so many of our viewers that have had cataract surgery or are going to have cataract surgery.
So we have world caliber ophthalmologists here. You know, Dr. Ahmed is remarkable and does a lot of research, and we're fortunate to be able to do just the beginning of a project with him, with the private sector, and probably with the public sector, where we take a look at people with cataracts. And not everyone referred to ophthalmologists need to be yet. So we're developing a tool to help primary care physicians and optometrists know exactly who is right to refer. And then once they get to the ophthalmologist, different people have different levels of need. So another tool to help figure out who are the most in need and to find a way for them to be cued more immediately. So what that does is controls the volume coming in and has the patient at the center of this. And what interests us, not only is it good to do this, but could it be repeated, and could you apply it to other surgery areas, hips, knees, and so on. So you start to see, it's kind of like the Lego approach to research, where you start in one place and you learn some things and apply it beyond.
So you talked about patient-centered care, and I'm wondering, Ian, maybe over to you in your KidFit program, how did you engage the patients in this, and was there any interaction with the patients involved?
So that's a really good question. So I have to say that we're planning to engage the patients because it's a program that we have funding for. It's actually a really interesting initiative from the province where the Ministry of Health identified this as a priority area in 2012 because of the increasing rate of obesity. So we've been given funding to start the program, and we also got some funding from a private philanthropic group. So we're posting to positions and hiring shortly, and working with the Institute, we're thinking about these different models of care. There's some evidence-based guidelines for how to treat children with overweight and obesity, but there's really no right way. So what I would like to do is to work with the Institute to try to develop these engagement strategies and to really reach out to patients and families. And we also want this program to have a community base. Based in the community, its components delivered in the community. We think that our philosophy is that this isn't going to be a medical treatment program. This is really a healthy lifestyle program. And so we want this to be a program that Mississauga is really proud of, that they feel ownership of, and that we can serve as a regional model for how you deliver this care in the province.
And do you have goals for this program? Do you have any ideas about what the outcomes might be once you deliver this?
Yeah, so the outcomes, you know, when you think about outcomes, and I'm actually part of a province-wide quality indicators working group and a network of pediatric obesity programs just like the one we're starting. We're taking a hard look at how you measure success in programs like this. So one of which is always just weight and weight status. But then there are all those other important psychosocial, behavioral, and mental health outcomes. And sort of self-efficacy for how you care for yourself. So as a group, as a network of specialists from all across the province, from Sick Kids, from CHEO, we're really looking at how we measure performance in these programs. So that's a work in progress, but one of the components is really going to be this patient-centeredness component. And we're trying to figure out how best to tease that out, because oftentimes just a satisfaction questionnaire isn't giving you the whole picture.
It is a big challenge. So another initiative I'm going to ask you about, Marilyn. I heard you talk about the vaccine and the flu campaign this year. It was a little bit different this year.
It was.
Yeah.
Yes.
Can you tell us about that?
Well, so inside of hospitals, of course, public health is very clear about vaccination rates required. Why? As people come into the hospital, they're in delicate conditions, so you don't want them to acquire a flu from us. And then the healthcare workers, of course, you want to keep them as healthy as possible. So public health really wants us to have up to 80% of hospital workers vaccinated. So this year, rather than say you have to do this and if not you wear a mask, we came with a different program, and that was to employ research methodology around consumer behavior and how you improve access, how you reward positive behavior, and how you actually use almost competitive information to show how well we can do that will encourage others. And so we moved the rate from low 50s to 63% in a shorter period of time. And there's debate about vaccination, and this year's flu vaccine maybe not the most effective as some years it might be. However, in healthcare, we don't have a big choice around that. We do the best we can for our patients, and so being vaccinated is part of that. So it was really quite interesting to do this, and it was an interdisciplinary team within the hospital of about 5 different departments. So it was a step in the right direction.
And it's certainly important for hospitals because we always know as we enter the winter season, our volumes go up in the emergency department. And why? Because there's so much flu activity, and I think this year we definitely saw the impact.
Well, and what people on the outside perhaps don't see is how far ahead we plan this. We are thinking about flu many, many months ahead of when it happens to make it as safe as possible for the people that work there and also for the people that come through our doors, both families and patients.
I just want to say congratulations for the work the Institute's been doing. It sounds like you've got a very unique team of designers. I've heard consumer kind of advocates. You've got PhDs and scientists.
Right.
What a wonderful privilege to lead that team. So if I could ask you just in our last minute, can I peek around the corner? What's looking to the future for the Institute?
Well, the Institute has a small dynamic team of people that not only do this research that we talked about, but we enable to help research and clinicians all around the hospital. So we have about 150 researching clinicians that do this out of the goodness of their heart on the corner of their desk and so on. So we are picking up speed in a way to help them and help them get their work published and recognized for what they do. But I think ultimately the whole point of this is to make Mississauga not only a better place to be well and stay well, but a place where we are proud enough to develop this and share it more broadly.
Thank you very much for joining me today, both Ian and Marilyn. I think we are proud of the Institute, and publishing actually allows us to spread beyond our walls.
Indeed.
And really teach others about the innovations we're doing. So thank you, and join me for the next segment on innovation.
Hello, welcome back to Talk Trillium. You might be wondering who I am. I'm Marilyn Knox. I work at Trillium Health Partners as the president of the Institute for Better Health. we're turning the tables on Patti this time. And so we have two guests with us. To my immediate right is Dr. Amir Ginzburg. He's a specialist in internal medicine and the chief medical person in charge of quality. So we're going to have interesting conversations with you. Welcome to the show.
Thank you for having me.
And Patti, everybody knows you as our wonderful host. You're also our Chief Innovation Officer and Senior Clinical Strategist at the hospital. What people probably know from this program is you're warm, you're smart, you're inventive, and you're absolutely the right person to be in charge of innovation at the hospital. So let's bring the people in the audience into this. What's something that's innovative that's happened at Trillium that you're particularly proud of?
Oh, Trillium Health Partners has had such a rich history of being innovative because I think as a community hospital, we've had to solve problems out there like a lots of demand for care without enough beds, and it really does push the innovation question. But your question about what am I most proud of, I think I'd have to say the design of an inpatient wing called formerly the West Wing at the Mississauga Hospital site. That design was created by a group of healthcare professionals that worked every day in that environment, and it really brought in patient-centered design in a very unique and different way, and tried to solve some of the problems about long distances for walking, bringing patients closer to their care providers, giving patients a much brighter environment with lots of window and access to natural light, and at the same time making sure that their basics such as access to a bathroom was really easy for them, even in a semi-private environment. And so if you've ever been a patient in the Mississauga Hospital West Wing, you might be in a room where your beds are not quite on a 90-degree angle, but on a 45-degree angle. And that really was to improve the patient experience, but also the caregiver experience. And through a lot of research, we did demonstrate that we were able to reduce medication errors, for instance, patient falls, and we're so proud of the team that really contributed to that unique and different design.
It's interesting, my very first day at Trillium, or my first week, I went with you through the Mississauga Hospital site, and you walk through there with Patti and people love her. They know her, she's worked with them for years. And the interesting thing is when you go to redesign the West Wing, as you called it, it isn't just a matter of how we do the best clinical work possible, because that's always what we're trying to do, but to actually put the patient in the center of this. I heard you talk about caregivers closest to them, the clinical workers closer to them, natural light, being able to move around. All these things really matter. And it's interesting as we move to Amir, we think about you on the quality side. And if people knew how you approach quality, you're positive, you're honest, and you are so constructive. You could think that the person in charge of quality might do this, but that's not what you're like. You won't let any stone be unturned, but you look at quality from that sort of perspective. Does that sound like you?
It's a flattering description, so thank you. You know, it comes down to the values of the organization that we work in, right? Yes. We heard in the previous segment today about courage and excellence. And to strive with those values towards a new kind of healthcare really requires us to do things better.
Yes.
There's a lot of things that we do in the hospital. We're always trying to improve, make processes tighter, provide a better patient experience, and really make sure that our staff are engaged and proud of the work that they do. And against innovation, which is what we've been hearing about through your research institute, you know, we're really tasked with doing things better on the quality side. In the innovation side, it's actually about maybe doing better things. And there's an interplay in the two, which is a really exciting space to work in right now.
So I've had the pleasure of seeing you train some of us during Patient Safety Week, for example, and it's really important to take learning from everything we do. We try for perfection all the time. It's not a perfect world. It's interesting to see that you've taken this part of your work, so internal medicine and quality, and you've actually spent time refocusing on the community. So there's a program called Health Links that you've been involved with. So it's interesting, it's not only the patient, as Patti talked about, inside the hospital, but as they move outside. Will you tell us a bit about Health Links?
Sure. So you're absolutely right. my job has always been focused on the patients in the hospital. So not really focusing on wellness, but trying to get people back to a state of wellness. And what we're learning now is that many of our hospitalizations are worsenings or exacerbations of chronic diseases that people are struggling very valiantly to manage in the community. But you know what? As people are aging, as the population is growing, we're seeing many more live longer, but with accumulating multiple medical conditions. And this piece of medical complexity really drives a lot of utilization in the hospital. And so the Ministry of Health, as part of their innovations, came up with this idea of health links. It's about cross-sectoral collaboration so that we're not just looking at an experience of care, we're not just an episode, but the whole journey across the system.
Both inside and outside the hospital?
Both inside and outside. So as an example, a patient with medical complexity who has 5 or 6 chronic medical conditions may have 6 or 7 different specialists and their family doctor, but the coordination of that care is often less than perfect. It's quite fragmented, and we all work in silos. The hospital is a silo sometimes, the community care can be a silo. It's about bridging these sectors together so that a patient experiences one complete coordinated plan of care across these different places.
So is this a dream or a plan, or is it actually happening?
It's actually happening. It's real.
And what's it like for the patient to go through this, or the person, let's say?
So I think it's very exciting. We've had patients who've been in the system and they feel like the system has provided an experience that's been less than ideal. They feel that care has had chances to be improved upon, but it really hasn't come to fruition. Those patients now, through this new model, which is Health Links, where we have a coordinated care plan for the patient around their own goals for their own care. You know, some people, no one ever asks them, what do you actually want from this journey or this experience? And we rally around their own goals in a coordinated fashion. And it's not just about the medical complexity. We're seeing huge interplays with social services, housing, transportation, disability, income, even food security. So all of these things are coming together within Health Links, doing things differently, really to deliver that new kind of healthcare in the community and perhaps even avert the need to come to our hospital.
Wow.
Keep people healthier in the community longer.
So it sounds like it's a test or a trial that's gone on for some number of people. Do you have hopes, and maybe Patti, you're the one to ask the question too, how do we expand this so it becomes the person's experience as they move in and out of the healthcare system? How do we make this more complete and integrated?
The Ministry of Health has certainly indicated that they want to intensify the HealthLink strategy going into next year. I think there have been quite a few HealthLinks that are up and running. The first 19 in the province were the early ones that have now had about 2 years of experience. There are about 70 others behind them, just ready to get going. And so I think in this region, we will be seeing more HealthLinks coming together and offering these services. And what's really fascinating is the hospital sector is learning more around the patients and what really determines their health beyond the walls of the hospital. When they come into the hospital, we strip them of their identity. Everyone wears the same kind of gown. We don't know their home environment, where they came from. But HealthLinks actually connects that with their home environment. And what's shocking is, some of the patients that come repeatedly back to emerge actually have no way of transportation. They have no way of getting their medications filled, and no wonder why they have a hard time maintaining their medication regime. So it's really us learning around social determinants and patient-centered care, and that's where innovation can come. That's where we can see opportunities for bringing new processes together that actually broaden the experience for patients and make it much more a patient-centered journey. So we've got great hopes that this will expand into the future, and we're seeing a lot more innovation around that sector.
It's so encouraging. So let's go back right inside the hospital now, and we think about innovation that's happening inside of Trillium Health Partners. You started out as a nurse way back when yourself, and have been in emergency. You've been out in the community being entrepreneurial, I can't even say the word, and you're able to bring all of this together as the Chief Clinical Strategist and Innovation Officer. Think about inside the hospital. What is going on right now that really is fueling innovation?
You know, I think innovation is really about problem solving in a different way, and we've got lots of challenges in healthcare, as you know, in problem solving, and the demand curve is so high in that, you know, our demographics are aging. It does present different problems and it requires different thinking for solutions. So some of the innovation is around new processes of care, it's new partnerships, it's breaking down barriers, and I'd say what's happening in creating a new kind of healthcare for a healthier community is partnerships and reaching out and bridging with other community agencies and creating a seamless transitions for patients and their family members as much as we can. So excited around the strategy.
So Amir, what's a lesson that you've learned from a patient that it caused you to do something differently?
Very simply, Wi-Fi access.
Yes.
You know, it's something simple, especially in the digital age that we live in, but it's more than that. It's about patients' experience of care. And when we ask our community, what will make things better for you in a vulnerable time for you in our hospital, we have a lot of ideas that come, some of which are simple just do it's. That we try to make things better for our patients. And Wi-Fi access, it sounds simple, but that's one of them.
It's really important. So as we wrap up then, let's just think about what's a final word that you have as we talk about innovation you want the people of Mississauga to understand that we're doing around health and healthcare.
Well, it's really engaging the hearts and minds of all our 8,000 staff, our 1,100 physicians, our 2,000 volunteers, and that's what we need to move forward in a different kind of way.
Excellent. And Amir, any last word from you?
Lots of work ahead, very good work to do, and exceptional leaders that I'm learning a lot from. And this is really exciting. We have a great team to move this work forward.
It's wonderful. Well, speaking of exceptional leaders, we have two of them right here. So Dr. Amir Ginzburg and Patti Cochrane, we thank you so much for taking this time, and Patti for turning the tables and letting us talk with you. So
Thanks for being host, Marilyn.
This is the end of this series. We wish you all well, and you'll welcome back Patti to the next.